Good morning, everyone. We will learn the basic life support, cardiopulmonary resuscitation, CPR. The emergency measures taken during cardiac arrest and respiratory arrest are called cardiopulmonary resuscitation, which includes artificial respiration and chest compression. Crew members should also be proficient in cardiopulmonary resuscitation in order to improve on-site and pre-hospital rescue capabilities, and significantly reduce emergency mortality and disability rates. Learning target: 1. Proficient in mastering the operational steps of cardiopulmonary resuscitation. 2. Recognizing the effective indications and termination criteria for cardiopulmonary resuscitation. Contents: 1. Steps of cardiopulmonary resuscitation. 2. Indications and termination criteria for effective cardiopulmonary resuscitation. 3. Think deeply. 4. Test. Steps of cardiopulmonary resuscitation. 1. Check and determine whether the injured person is conscious or not. When personnel suddenly fall to the ground, the on-site personnel should first determine whether the environment is safe. If there is danger, they should be promptly transferred to a safe area. If there is no danger, try not to move the patient as much as possible. Then use actions or calls to determine whether the patient is conscious or not. 2. Call out for help from other personnel. When the patient shows no response, it should be determined that they have lost consciousness and shout loudly, "No problem, someone has fainted, come and rescue." To seek help from other crew members. 3. Determine if there is a pulse. By performing a carotid artery test, it can be determined whether the beneficiary has a pulse. If there is no pulse within 10 seconds, it can be judged as cardiac arrest. 4. Check breathing. Use your ears or close proximity to the mouth and nose of the injured or sick person to feel for breath, while observing their chest movements from the side to determine if they are breathing. When observing, you can time according to the method of 1001, 1002, 1003. CPR 1. External chest compressions. 2. Open airway. 3. Artificial respiration. CPR position: ensure that the patient lies supine on a hard board or floor. Pressing position and depth: usually press the middle and lower third of the sternum midline, or the intersection of the line connecting the two nipples and the sternum midline. The depth of compression should be such that the sternum sinks by 5 to 6 centimeters. Artificial respiration. 1. Mouth-to-mouth artificial respiration method. The rescuer blows exhaled air into the patient's lungs to expand them, and uses the elasticity of the lungs and chest to retract and allow the patient to exhale the gas. To the oral to nasal artificial respiration method. This method is used for patients with lip injuries or closed teeth. The rescuer lifts the patient's chin and closes their mouth, then seals the patient's nose with the mouth and blows gas into the patient's lungs. Defibrillation: 80% minus 90% of pulse arrest is caused by ventricular excitation, and simple chest compressions cannot completely solve problems such as cardiac smooth flow and restoration of blood microinjection. The best method is defibrillation with electric shock. For every 1 minute delay in defibrillation, the patient's survival rate decreases by 7% to 10%. 2. Effective indications and termination criteria for cardiopulmonary resuscitation. Indications for effective cardiopulmonary resuscitation: the degree of soul obsession becomes lighter, with various reflexes, unconscious movements of limbs and mouths. Autonomous breathing gradually recovers, and regular carotid pulsation can be felt. The complexion turned rosy, the bilateral bottom hole shrank, the light reflex recovered, and the electrocardiogram confirmed the recovery of heart rhythm. The determination of termination of cardiopulmonary resuscitation is based on the effective recovery of spontaneous breathing and heartbeat, or the replacement of rescue by other professionals. Before starting CPR, it can be determined that the heartbeat has stopped for more than 15 minutes. Cardiopulmonary resuscitation lasts for more than 30 minutes without heartbeat or spontaneous breathing. And there are no further treatment or conditions for hospitalization on site. Reflection section 1. Briefly describe the steps of cardiopulmonary resuscitation. 2. Briefly describe the indications for effective cardiopulmonary resuscitation. 3. Briefly describe the determination of termination of cardiopulmonary resuscitation. Test 1. After sudden cardiac or respiratory arrest, all medical measures taken to restore the heart to its original state and allow for spontaneous breathing are called. For artificial respiration, B. Cardiopulmonary resuscitation, C. Cardiac massage. Select option B. 2. Which of the following is incorrect? A crew member must meet the competency requirements stipulated by the Convention and the Maritime Safety Administration of the People's Republic of China after training. The crew members have mastered the specific operations of cardiopulmonary resuscitation, fracture splint fixation, spinal injury handling, vital sign examination, etc. C. Crew members do not need to meet the mandatory minimum requirements for medical emergency under the Convention and can also obtain a certificate of qualification. Select option C. For when using mouth-to-mouth blowing for artificial respiration, the effective indication is to C. Abdominal distension, B. Oral distension, C. Chest distension and hearing respiratory sounds. Select option C. The above content is about basic life support, cardiopulmonary resuscitation, CP, and related knowledge. This lesson ends here. Thank you everyone. See you next time.